Good afternoon. It's so good to see all of you here. Thank you for coming and planning to spend the next hour or so with us. Today, I want to welcome you and let you know a couple things before I introduce our speaker. We're going to ask that you add comments and questions in the chat function throughout the presentation, and we'll have Dr. Nunziato address those at the end of the session. You'll also notice that we'll add a CME link for you in the chat. And if Dr. Nunziato references particular articles or other items of interest, we'll do our best to put those in the chat for you as well. Presenting today for us, we have Dr. Jaclyn Nunziato. Dr. Nunziato is an associate professor in the departments of obstetrics and gynecology and health systems and implementation science. She's also an assistant clerkship director in health system science with a focus on the policy and advocacy domain. Dr. Nunziato is also a graduate of the 2021-22 Health System Science and Interprofessional Practice Clinical Champion Faculty Development Program. She's also a vital part of our Roanoke Valley community, where she serves as the executive director and founder of Huddle Up Moms. I'll now turn our time over to you, Dr. Nunziato.
Thank you so much, Sarah. So today we're going to be talking about change agency, advocacy, and managing your passions through writing. So we'll get started because there's just so much to cover. I'm going to try and be really mindful of time so I could keep questions for the end. So I wanted to start off with no financial disclosures, but I do want to talk about what it means because it really drives my advocacy work to be in a profession that I truly love and that I'm passionate about, but also recognize one that has a foundation that in some instances is rooted in racism and sexism and other factors that truly influence the delivery of care today. And that's hard. And leaning into that as a human being, as an educator, as a woman, as an OBGYN provider is an important part of our everyday delivery of care. It's also an acknowledgement that there are many things about delivering care to women specifically that can often be politicized, and that it's important to recognize that and really to take ownership of the change that we can create as providers. And then finally, after every time I say something heavy in a presentation, I always show my kiddos. But in this situation, I want to show them because I want to acknowledge my own bias in this presentation. My experience, my research are my own. And I know every single day that they interweave themselves into how I provide care, the type of provider that I am, and really do influence how I see and envision healthcare and healthcare delivery and how I want the system to be and how I want it to change. And I do acknowledge that. There is a lot of research and policy and discussion and theory interwoven between in my presentation, but a lot of it is opinion. And so that's a big focus on today. And one of the other things I want to talk about is it's important if you're inspired or you want to do this work, that you really understand and know your institution's policy on advocacy. And that includes the greater system, your society as a whole, and that you really want to make sure that when you're representing your institution or a governing body or a community or organization, and when you're expressing your personal and professional views, and really want to harp on the fact that it's important that you address that really early on in any presentation or forum that you have. So let's get started. So these are the 3 intended learning objectives. So hopefully by the end of this presentation, you can construct your own priority list for becoming the change agent that you want to be personally. These are my kiddos, and you could see why I'm biased in my women's health kind of fight here. So learning objectives, thank you so much for that. So I also want you to examine the opportunities for advocacy and writing within your own circle of influence. And then I want you at the very end to identify a topic that you're passionate about that really drives you and motivates you, and create opportunities for writing to really push that movement forward and to create some necessary change. So what does it mean to be a change agent? I know we all put on the white coat, back to the white coat ceremony. And what does that mean? So our job as a clinician is to do no harm and to serve. But what I want to talk to you about today is that we also have this a unique ability to step outside of just the clinical exam room, outside of the hospital system, and realize that we have a capability that many of us don't even know that we possess. Advocacy and writing and education allows us to amplify the voices of those who can't be heard. And so that white coat that we have, that cape that we wear, I really want everybody by the end of the conversation to understand the power that comes with being a physician, because we have this unique opportunity to take a combination between our passions and the voices of those who can't be heard and our area of expertise and blend them together. And I would argue that it's considered a superpower. So what are the characteristics of somebody who's a change agent? So when I first started learning about change agent and full transparency, I had some imposter syndrome. This is a famous public health change agent diagram that came out in 2011. And it really amplifies who a change agent should be and what are some of the characteristics. And when I looked at the list, I felt completely overwhelmed, but I knew that I wanted to become somebody that could really make significant change when it was necessary. And so I did what I do with all problem solving. I picked the low hanging fruit. So if I'm not anything, I will say I'm enthusiastic and I'm passionate about causes. I consider myself somebody that's effective connector. So one of my favorite things is to find two people that may have a shared experience or a shared passion and put them together. So that way we're not working in silos, we're working together. I've really tried to be a lifelong learner and committed to being humble in the fact that the scope of my practice doesn't allow me to know everything about everyone. And so those are the kind of the four things that I consider some characteristics that I possessed, regardless of what I named them prior to becoming a change agent. And then over the last couple of years as a provider, I've decided to kind of tackle this in a stepwise approach. And I want you to do the same and kind of look at the circle and figure out what characteristics are already the things that you do. And over the next couple of years, plus the rest of your career, what can you do moving forward? So I hope through a lot of excellent mentors and allyship, most of who I think are on this meeting today, that I've become a critical systems thinker. And that really plays a role into how I view the world and how I solve problems. And I've really tried to gain a better understanding of the environment and the social and economic connections in a really public health solutions driven way. And then to be honest, I'm very humbled by the fact that there are things that I constantly have to work on and be very intentional about. And so for me, that's to continue to be a strong and engaging and dynamic communicator. And that's not just with speaking, it's not just with day-to-day interactions, but for me, writing was something that was not my strong suit. And it's something that I've had to be really intentional about it. So don't let that kind of sway you from using writing to advocate for yourself and for your passions. And then the other part of that is something that I had to have like come to myself to really reflect on this, but I've tried to really engage in self-assessment and reflection and analysis. And I try and surround myself and have been really fortunate to do that with people that are honest and true and have really allowed me to be the person that I am and added to that by their years of experience. And I think when you have those things and those elements, what you see is that when you're being a change agent, you can be proactive and not reactive. And it also allows you the ability to be a responsible citizen and just a good human being in general. So when I think of change agent in general, what I think about is who is in the driver's seat? What driver do you want to fuel your passion, your idea, your change, the purpose of what we're discussing today? This is the driver's seat component. And so when I talk about being a change agent, I talk about several steps. This is adapted from a lot of business models, from some public health models, and I've really kind of used it in a step-by-step approach to gain a better understanding of how I can get to the end goal. And so the first thing to do is really to define your purpose. I write this out, and it's really helped me to keep a narrowed focus, especially knowing that I can have these grand ideas. And if I don't niche down and narrow my focus, I know that I won't be successful. So part of that is creating goals for yourself as well. you want to educate yourself on the issue at hand. I chose the step-by-step approach, but knowing that stepwise you can go up and you can go back. And so I want to emphasize that when you're trying to create change, there are many steps moving forward that are equal to the steps that you have to move back to really create a strategy that will work for the issue at hand. And part of that is building your network with equity, right? And then developing a strategy. It took me a long time not to lead with either a complaint or the issue at hand without recognizing that what I present has to have a solution really at the forefront of what I'm speaking about, right? Because at the end of the day, the return on investment is what's going to propel your passion and what you want to change in the right direction. And so part of that is being able to embrace collaboration. So within the hospital system, within your circle of friends, within the community, and then to be able to communicate effectively. And for me, this takes actually writing it out and what I want to say in order to stick to the point at hand, to keep within the scope, and to really stay within my purpose. And then you want to mobilize support. So this is one of my favorite steps because I think a lot of what's done in healthcare or a lot of what's done in change advocacy is done in silos. And so there's already people in the community doing really wonderful work. And as a change agent, especially as a provider, it's our job to connect those together and to elevate them while we're moving forward. And so that really is how you influence decision makers on all levels. And it's important to be adaptable and resilient. And then at the end of the day, if you don't measure it, it does not happen and it does not cause change, is what I've really learned. So what is the difference between advocacy and being a change agent? So for me, advocacy is the journey to get there. What are the policies? What are the procedures? What are the barriers? What are the things that I have to do, including the players, the key players, in order to get to the goal that I want to reach? And so I use this public health model often. It came out in 2015. It's been adapted millions of times, but I always refer back to the original because I think it's so relevant and because I want to show it in its most pared down framework. And so I talk a lot about your circle of influence because when I talk to students, when I'm talking to individual learners, people don't realize how influential they can be without identifying themselves as a change agent or without. What they usually need is somebody to empower them and to recognize and to allow them to see all of their circles of influence. And so the circle of influence can start at an individual level. For me, that starts in my own home, how I'm raising my children, how I'm, showing them, the ins and outs of the world, our beliefs, our, how I'm presenting myself on an everyday basis. And then the smaller circle of my social interactions. And then you really can branch out to other circles of influence. And what I like about this is that it's a continuing sphere back and forth, right? Sometimes it's pulling the community into society or pulling the community into an organization or getting a global agenda to fit a state need or an institutional need. And so it's really kind of important to really, when you're mapping out how you're going to create change, to look at your circles of influence. So when it comes to change agency and advocacy, I often have a hard time differing the two. And so for me, change agency and advocacy are complements of each other. I don't know how many of you remember going back to what a right angle is, but change agency and advocacy to me make this right angle, this perfect angle. And for me, how I've intersected the two is through writing. And so I'm a visual learner. I don't know how many people are on the call, but for me, when I think about this, I think as being a change agent is the driver that you want to be. Who do you want to be in the driver's seat? Who do you want to be the person that's going to be pushing the agenda, that's going to elevate the voices of others? Advocacy is how are you going to get them there, or how are you going to get yourself there? What tools do you need? What connections do you need? And then writing is the vehicle that you're choosing or the platform you're choosing that will get you there. And I love this analogy because different vehicles can get you there, and with different challenges, with different barriers. Do you need to get there quickly? Is there a deadline? Do you need to ride something that is popular in social media and on media right now? Or can you take a slow, train or a slow ship? Can you work over time, which most change occurs slowly over time? So picking your vehicle like writing is going to be so important. And so that's how I've chose to do it. So why advocate through writing? So it is our professional responsibility. I put my own societies up there, including AMA, but we have a responsibility as the subject matter experts and as a position of power and authority to elevate the voices of our patients, of the areas that we need significant change, so we can deliver care in a more equitable way. And so the difference in how I see this is, do we want to tell a narrative or change a narrative? Because at the end of the day, silence is acceptance, and that's not where we want to be. And we also want to kind of add to this misinformation or disinformation that is occurring throughout all of medical perception in society right now. And I would argue that writing is easy to disseminate. You can edit, you can change it, you can adapt it, and it's enduring. And so the last thing, again, is just to kind of remind everybody that with that white coat and with your ability to be a change agent, with great power comes great responsibility. I always think this is funny because Voltaire, if you like literature, Voltaire actually said this, but whenever I hear it, it's always quoted as a Spider-Man quote. But for me, I take this to heart because we have power that we don't realize. And I can show you that in the next slide. So this is one of the Gallup polls, which comes out every year and talks about the most trusted professions. So every year, nurses and doctors, pharmacists, all healthcare professionals are at the very top. Think about that, what that means. That means everything that we say, everything that we do, the recommendations, the advice. It may not feel like it, honestly, sometimes in the moment when you're with a patient or when you're out in the community and someone is really on one side of the fence or the other. But at the end of the day, we are a profession that is historically trusted, and we need to lean into that and respect that and use that as a platform. And so I'm going to kind of go through quickly some of the principles of writing that have really helped me when it comes to advocacy specifically. So these are kind of the 6 pillars that I use, again, adapted from Elements of Writing, very classic and old resource, but one that's adapted to advocacy and works really well. But you always want to know your audience. That's so important, right? 2 weeks ago, I was speaking to the Retired Teachers Foundation. And so, you have to know who the makeup of your room is. You have to know kind of what they're feeling, what they want. You have to know what their goals in having you speak are, and you have to know what your ability to create change in one specific environment is. So it's the same with writing. Who is your audience? You have to know what the purpose is. You really have to know what the format is. So you don't want to write something that is, 8 pages long when the majority of people, especially nowadays, want content that is biteable, that is, read in less than 60 seconds. And so some of that really is, how do you get to your point? How do you create change in a small format? And so that really means that content is so important. And we'll talk a little bit about what makes like high volume content when it talks about, when we're talking about ways to advocate. And then one of the 2 things that I think is not usually in the principles of writing that I've added is, you always want to interlace DEI, and trauma informed into your principles, because again, we have the opportunity to speak for those who are marginalized. We also have the opportunity to write and to create and to find opportunities that can take these passions and interlace them in anything that we want to push as far as an agenda or a change within a system. And so for writing for change, so what does this mean when it comes to change agency and advocacy? So I'm going to go through several examples, and then Sarah, if you can just text me if somebody has kind of a question during this portion. But there are several opportunities. I mean, I could spend days and days on this specifically on each one of these, because I think people don't realize, as professionals, as providers, as clinicians, as researchers, we have the ability to influence change on a level that most people will never get that opportunity to have. And so the several categories I'm going to talk about are personal narratives. I'm also going to talk about opinion pieces, a little bit about research and white papers, a little bit of quality improvement, how we can use education, social media, and policy and procedure. Before I go, does anybody have any questions? Kind of two halves. Okay, I don't see any. So we'll just keep moving. Okay, so writing for advocacy and change agency when it comes to a personal narrative. There's a funny story to this. The first time I was a new transplant into Roanoke, and I don't exactly remember the specific topic, when the news reached out to the department to ask if we would talk about maternal mortality. And I decided I want to talk about the fourth trimester. I'm interested in this conversation. I really want to push this narrative and push the agenda. And I had never been on the news before. And I sent a number of bullet points to the news reporter. And she sent me an email back and said, I really want to do a pre-interview. And she asked me the first question, and it was basically, tell me about maternal mortality in the fourth trimester. And I talked, I think it was longer than 15 minutes. And when I stopped, the reporter said to me, thank you so much. Have to tell you, that is very boring. And I was really personally insulted in the moment, but it taught me a very significant lesson. And that's that you need to be really creative when you're telling your story. You need to be really creative when you're trying to create change. And you can do that through telling a story. And that was my first example of hearing myself talk about something that I'm very passionate about without really making a connection to the greater audience or the audience that I was about to speak to. And so if you want to be a change agent and you want to advocate, one of the things you have to get really, really comfortable with is, what is your personal narrative? Or what is the story that you want to tell when you're creating a platform for change? Because you want to be able to communicate effectively. At the end of the day, there is a marketing component and a branding component, because you want to appeal to the masses. Maybe you want to interlace history. Maybe you want to be creative. Maybe you want to evoke emotion. Maybe you want to share some of your experiences. But one of the things you want to do always is try and establish trust. And that can be really hard when you're talking about change. And so part of this is being really reflective about who you are and the story that you want to tell. And so for me, this narrative has changed a lot. And so every year I kind of take an inventory of where my priorities have changed, what experiences have I had that are now pushing the agenda maybe in a different direction. Again, that's going kind of, instead of that step up approach, kind of taking a couple of steps back, which is okay. And it also allows you the grace to not tell your narrative when you don't feel emotionally ready to share, or when you don't feel like communicating effectively. And so if I'm sharing mine, and hopefully at the end of the presentation, you can feel confident enough to share your narrative and to kind of create a list. So this wasn't always the case, but when I became a mother, my personal narrative, that became at the forefront of all of my stories. It changed how I took care of patients. It changed my views on society. It changed a lot of my political views. It also changed the fact that I'm a woman who takes care of women. And it really has pushed the the issues that I feel want to be at the forefront of my story and why I want to advocate. Being a woman who takes care of women, especially pregnant women, are often marginalized. Instead of being looked at as a really complicated patient, we often are looked at as a vulnerable patient population. And I think that that keeps us out of a lot of research. It keeps pregnancy out of a lot of forward progress. And so that's become a big passion of mine. And that really goes with access to care inequities, a mental health stigma that I think is really pervasive and ubiquitous throughout the country. There's a lack of women's health education. I never thought that that would be something that would be at the forefront of my priority list, but time and time again, every single day, I listen to women who lack the education to make informed decisions for their health. And I really think that that starts in the classroom and really needs to be an area of reform. One of my big passions over the years has become community engagement. There needs to be more involvement with nonprofits, with foundations, with the departments of health. We're doing such a good job here at Virginia Tech Carilion School of Medicine and Carilion, and I know that we're continuing to grow with a lot of our partnerships in the community, but it has to keep happening and it has to have momentum to it. And so that really takes somebody being a change agent and advocating for these changes. Same thing with lack of resources. When I started to get into the work of trauma-informed care and I started screening my patients and realized how ubiquitous trauma is and violence is, specifically against women and children, it became a priority and something that I knew I wanted to put in my advocacy reservoir. And so that really goes to this global violence against humans, regardless of the fact that I take care of women primarily. And so how can you do that? And so opinion articles are an easy way. It's also a nice professional thing to add to your professional development. This is I think, one of the most powerful. And again, think about my priorities. So I'm only talking I wanted to give you guys examples of how you can do it the way you want to do it based on your priorities. So for me, this article came out in January of 2022 called The Motherhood Penalty in Obstetrics and Gynecology Training. It highlights the fact that women who practice medicine, especially in the field of OBGYN, are less likely to breastfeed, are more likely to have complications like preeclampsia, postpartum depression, and some of the other complications related to maternal and perinatal outcomes. And so this opinion piece was actually done by a group called Physicians in Medicine Group, Physician Moms in Medicine. I joined this group when I became a mother myself. They have a follow-up paper that's coming out, and I felt really honored and privileged to be a part of taking those surveys while I was pregnant, especially as somebody who was pregnant in COVID. So I'm interested to see what the follow-up commentary. These are short abstracts that are usually less than a page or 2 pages, depending on the journal. And they really are more of statistics interlaced with personal and narrative stories. And I think this is kind of an easy starting point. So something else, I put this article in here because I wanted to kind of show that you have to play up to your audience when it comes to being a change agent and when it comes to being an advocate. When the Valley Business magazine reached out to me to ask me to write a commentary, at first I thought, okay, this is completely out of the scope of what I do or what my comfort zone is, especially when it comes to business. But I do what I always do in that stepwise approach. And I thought, how can I interconnect the two, right? And the truth is, you can do that by keeping your passions up at the top and figuring out how the system around you influences that. And so I wanted to make it, usually when you do a commentary, and I'll get to that later, you want the topic to be eye-grabbing, you want it to be punchy, and you want the narrative to be really short and quick and full of some statistics that are a little bit alarming and eye-opening. And so that's an example of what I did here. I think when it comes to women, I don't know, I'm sure if you think about it, it seems obvious, but mothers, not just women, but mothers are the highest consumers, meaning they spend As far as household income, they spend over 90% of the income. And so it's interesting to me that they're often not considered in the financial world like the primary target for meeting their needs, meeting their expectations, and valuing them in society in the ways that we've done in other sectors of business. And so that's really what I wrote about. And so there's no way if I wrote this article about maternal mortality or, Black maternal mortality or rural health, in this specific audience, I was able to achieve the same thing, but to do it with the intention that I knew the audience here would be business and business focused people reading the magazine. And so other ways that you can do that are things like an op-ed piece or letter to the editors. This is the perfect example of really knowing yourself. So for me, a letter to the editor, as you can see, being curt and direct to the point is something that I'm working on, but in 200 words or less, that's not my cup of tea, and you have to know yourself. It's also not my cup of tea to be punchy and quick, and I'm not good at that. That's kind of a long-term goal for me. But that's something that's really quick and gets a lot of attention. It's also done in a moment. So if there's anything that is on your priority list that all of a sudden becomes on the top of either a media spot or something that all of a sudden everybody's talking about, if you write these pieces ahead of time and kind of wait for the golden opportunity to present them, things like letters to the editor and op-ed pieces are a little bit easier to do. So for op-ed pieces, this is something that I think is a little bit easier, especially for us as providers, because we often see that a lot of the medical articles that are written in journals, in the newspaper, in public magazines are often not written by subject matter experts. They're literally people that are Googling and trying to interpret things that sometimes they don't understand. And so honestly, as a medical provider, I really feel like it's our responsibility to write in and to write op-ed pieces. Once you start writing these things, I have a good friend at Hopkins that's amazing at writing these, and she gets her stories picked up often. This is also the time where if you've already written your narrative and your personal story, this is where you can kind of tweak it or change it. You can also, I'll talk about that a little bit later on, but you can also use this opportunity to tell the story of a patient or a community member. You don't want to put any details and you don't obviously want to violate HIPAA or anything remotely close to that, but it's that personal story that you know is going to connect to masses everywhere, right? Being a mother, knowing mothers, being a woman, those are things that are actually very global shared experiences. And so you can kind of use the multiple stories that you have, even from being a provider, your patient that couldn't get her insulin filled because of an access to care issue, your patient that had a birth trauma because there was no translator services. That's not something that happens here, but I have heard that happening at other places. And so this is your opportunity to take those experiences and to turn them into something positive, because that can create some significant change. So this is kind of examples of providers putting that foot forward and writing op-ed pieces and letters to the editor that really picked up some national and international news across multiple priority areas. So you can see here, a lot of providers took to writing these over the last year. This is just the year anniversary of Roe v. Wade. And so a lot of pieces went out this week too, but it's also opportunities to talk about things like maternal mental health, to talk about postpartum care. If you have something that your state, your organization, or your society is about to present on. So for example, if your organization is about to present on or release a statement about something, that's a good pitch or a sell to write about. If you see an article or something that's happened recently in the news or in your community, that's a good thing to write about, because you are the subject matter expert. You are lending your area of expertise, which is bipartisan. And that's something that can appeal to the masses, and it can be used for an instrument of change. And so research articles and white papers, I think here I'm kind of preaching to the choir as far as how influential research and white papers can be when it comes to advocacy. But I wanted to kind of show some specific examples where we're hitting those 6 areas of focus when it comes to writing, and how over the last few years specifically, we've used DEIB initiatives and trauma-informed to write into our research protocols, to be more equitable, and to really kind of bridge out into the community in order to elevate and really represent a more inclusive research population. And so this is just an example. Association of race with urine toxicology for patients that are pregnant during labor and delivery. This one is about MIFI combination in comparison. It's articles like this that come out that can be the tools that we use to create and dismantle misconception when it comes to speaking publicly. Because at the end of the day, our job as providers is to really allow the public and either government officials or whoever you're talking to really understand what it means to be able to deliver quality care to an individual, and how there are significant either political changes or policies or procedures that are hindering our ability to deliver good care. And so we need research to do that. It is a tool that we kind of, I think, is an underutilized tap resource when it comes to change and advocacy on a public perspective. And so one last thing to kind of talk about research, but it's also really important to get your research outside of a medical journal. That's something that a lot of us across the country are working really hard on, changing the culture of research in what is public and front facing. If you are on social media or if you're in the news right now, there's often a misinterpretation of data. There is a misrepresentation of results and outcomes. And it really is up to us, those who are doing the research, those who really understand the science behind it, to present that to the public in a way that makes it digestible, that makes it understandable. You know, in OBGYN, I saw that firsthand when the ARRIVE trial came out, or when we have a trial that comes out that we then change to clinical practice. It's confusing to patients, and it's an example and an opportunity for you to go and make significant change in a way that educates your patients, because they get confused and they don't understand. And then there's an element to misinformation that's publicized. And so we have the opportunity to be change agents in the research that we're doing. For quality improvement, so I just picked 2 examples. Again, I think this is kind of, we could talk about this specific topic in depth or in detail over different conversations, but the 2 that I chose to kind of pick about, we just presented about both of these nationally, are the the M&M conference, mortality and morbidity, and a root cause analysis. And so you can really use quality improvement to address systemic problems. So this is that HSSI component that I love. You can use it to really examine and elevate DEI. You can elevate reproductive health justice. You can elevate social determinants of health. And so, and by doing that and writing it down, what you're doing is creating a paper trail, right? Which sometimes makes people a little uneasy, but I'll tell you, if you're not reporting it, if you're not showing significant change in a very intentional way, it's hard to change globally, right? It's hard to change as an institution. It's hard to change within a department. And so this is just kind of an example of how Yale right now just came out with at the end of last year, a health equity checklist. One of the organizations, FACOG, that I'm on, we're in the middle of writing a white paper about how to incorporate advocacy and cultural changes into the M&M process. And then the other thing is taking quality improvement tools and adapting them and changing them to fit your passion and your purpose, using that DEI component to it. So this is kind of the telltale framework that most people use when it comes to root cause analysis. And what we're encouraging you to do is to add components of social determinants of health, add transport, add food deserts, add bias, add racism, add economic factors into the cause analysis and publish that. So that way people understand that there are many different barriers to care, that it's not just within the hospital system. And so kind of moving forward, so writing for advocacy and change agency when it comes to education. So this part, it kind of starts with the students or even with undergraduates that come, the students are put on that white coat, they graduate into residency and they often feel like they do not have the power to create significant change and they don't realize how influential they can be. I know from sitting on a bunch of state committees and national committees, we want to hear from students. We want to have a pulse on different levels of learners, different levels of education, different levels of the healthcare system. And we want to hear from them their perspective and their narrative about what the patient experience is. And so they do have a lot of power. And some of it is, as allies and mentors, it's important to make or help the students realize their potential. And so these are just kind of some specific examples. So you can redo a curriculum. We've redone OSCEs. We have a new AI focused on just advocacy. We have one focused on trauma-informed care. You can really focus DEI or change, use PBLs as an element of change. You can do a curriculum redesign, which is much easier. And then in talking about how you can do it on a local level. So one of the things I do, or I try to do, I often am pitching stories, blog posts, things that I want people to write about or to listen to, and they're not picked up, and they're not picked up until something happens, to be completely honest. But when something does happen and everyone's talking about it, you get to choose to make that. You get to look at your priority list and figure out how, as the subject matter expert, you can bring change on an individual, on a state, on a local level. And so this is kind of an example, but I was able to write up significant talking points to release to social media outlets across locally and across the state. And we did that, ACOG and SASCOG did that as well, our governing bodies. And in order to talk about postpartum depression, when psychosis was at the forefront of media conversation. And so this is another way that you can use writing to really push the agenda and the priorities that you already have. And the other way to do that is to optimize and write for so if you're thinking about those circles of influence, really optimizing those levels. So the Department of Health is always looking for subject matter experts. Society legislative sections are also always looking for providers that either want to be subject matter experts or that want to speak on a specific scope or nuance. Same thing with the State Medical Society that drives a lot of our billing and coding. They're always looking for subject matter experts, and the students are as well. This is just an example of something that we did here at Virginia Tech. In the OBGYN, we created a training day, an advocacy training day that was more about teaching the students how to be advocates and change agents and what that means, and less about specific topics. And the students were able to do that across the state. We're hoping to elevate this next year, and we've created kind of a manuscript and a curriculum for that, and are waiting for IRB approval to expand that. So again, that's using different areas of writing to create a consistent message of change. And the same thing with national organizations. So organizations that have a lot of following, like the maternal, and again, this is me speaking from my profession, but the Maternal Mental Health Leadership Alliance, the Policy Center for Mental Health, Mom Congress, they're always looking. These organizations have millions of followers, and most of the people that are writing their content are on the legal side. They're educators, they're lay people, but they often miss having providers be at the seat of the table in order to create some significant change. Over the last couple of years, there's been a lot more providers that are willing to kind of lean into the advocacy role. And so these specific organizations have done a wonderful job really using the stories that providers have given them to elevate those voices in really meaningful ways. And this also, in the realm of recognizing and respecting that everybody is at capacity, I feel like that individually all the time, joining forces and collaborating, which is in that step-by-step approach, is the way to do this, right? You don't want to make the actual policies. You don't want to learn the nuances of what bills are coming up when. You may, if that's like what your priority list is, but these are ways that you can contribute in really meaningful ways without having that heavy burden or the lift. And so I also want to talk a little bit about other opportunities when it comes to education, because things like Wikipedia and Medscape, I know we always joke about Dr. Google, but the truth is Wikipedia, the most commonly searched Wikipedia is healthcare topics. And every single month, 18 billion people land on this page. And I want to talk about the fact that most of the information is not written by medical providers. And then when you look, they have to report this, but when you look at the diversity of the authorship pool, 85% of them are male and 89% of them are white. Okay, this is an opportunity for us to take the things that we already do really, really well and contribute in really meaningful ways. Medscape is very similar. And so in knowing my audience, I didn't want to spend too much time on social media, although if you look specifically at the Society of Surgeons, that's not right. But if you look at a lot of AMA, a lot of the medical societies, including ours, they have all put out statements over the last couple of years, and COVID has really propelled that forward to say that we need to step up to this platform of writing, of communication, because this is where, this is kind of replacing that Wikipedia, that Medscape search. And so this is just kind of a infographical representation of how much people are using social media to get their health information. And so we have the opportunity to advocate for the correct information by educating our patients. And so just some quick information. If you think social media is not a good platform for advocacy, you're wrong. 2.5 billion monthly users, really primarily, again, knowing your audience, Gen X, boomers. Instagram, 1 billion monthly users, really more targeted toward millennials. Twitter is actually a huge healthcare platform. We have a lot of providers on Twitter. It's cross-generational. The average age is 40, 60% are male, but 63% of the users are over the age of 35. And so it can seem sometimes overwhelming. I don't suggest going on all forms of media, but getting the information and truly focusing on education in this way and advocacy and what your priorities are an easier lift for sure. And again, this is just one example. The power and influence to change as a physician, again, there's great responsibility there. And so this is just an example of one of my colleagues, Megan, who I've presented on this topic with before, and she tweeted about Roe v. Wade and had 25,000 people interact with her statement in less than 8 hours. And so it is a form of advocacy, and it can be something that you utilize to propel a purpose or an agenda item. And then I don't really want to get too much into policy and procedure, but I did want to kind of a little bit just talk about some really easy things that you can do as a provider. I think I have 10 minutes left, so this is kind of one of my last. Thanks, Sarah. So policy development. So this is something that I, to be honest, never thought that I would be involved with. But again, there's some things that you just cannot say no to because it's an opportunity to elevate the voices of those who don't. So I don't know if you've ever seen this, but it's a power versus interest grid. And The link is there and you can kind of play with this grid. But what it basically does is show like who is developing policies, right? So if you look, who has low interest and low power, that's actually the majority of people. If you look who has high interest, right, but low power, that is usually somebody that's either had a negative experience or really passionate about it, but doesn't have the platform that we have, doesn't have the privilege that we have. And so where physicians usually lie is in context setters, right? So we have power, but we may not have interest. And I don't like us in that category because I think that kind of limits what our ability. It says that physicians should be subject matter experts or SMEs. And I want to, to implore you and to inspire you after this conversation is that we could do more. So we could be the players here. We could have the power and we could show the interest and we really could be the itis for change. And it is our opportunity to magnify those who are in this the lower aspect of this grid. And so one really easy way, I don't know how familiar you all are with public comments, but every time a healthcare regulatory agent, such as the CDC, HRSA, FDA, or OSHA comes out with a new guideline, the regulations are so that they have to go through a process. And one of the most important and critical aspects of this process is commenting. And so that is actually your opportunity and often pushes the agenda, whether or not this is going to move forward as a guideline or not. When you look at who's commenting on, we are actually one of the lowest professions commenting on proposals, which is so interesting if you think about this is a science, this is a healthcare governing bodies that are really dictating, how we deliver care, yet we aren't the people that are commenting. We aren't the people that are having a say in what moves forward and what doesn't. And they have to have comments in order to move forward. And so this is, I'll link some of these, but this is a way that you can easily comment on any regulation that's coming up. And so communicating with representatives, I'm almost finished. So, but don't forget, our elected officials work for us. Emailing them, a phone call is even better. Social media, if you're going to email, a social media amplifier is always good. You want to make this really short formed communication. And we talk about like just 3 forms. You want to say who you are, which always kind of ropes them in. You want to have one hook, which is usually a patient story or a personal story. And then you want to really, write your position and what you're writing about and say thank you. It's really critical if you can identify the legislation by name and number, although you don't have to. And then also really, really a bonus if you can put a story in. And so this is just kind of a summary for, again, each of these topics I think I could talk about for hours, but I wanted to give really concrete examples of how you can take change agency and advocacy and writing as a medical professional or as a researcher or as in the healthcare system in general and put that into an action plan. I use this picture because I feel like by the end of this, the content is so heavy that you may be kind of ready to tune it out. This is an actual picture of my daughter right after she told me, like, Mom, you're talking too much. I stopped listening because it's too long. And so I want to be really mindful of everyone's time. And then these are really just a call to actions and questions. But if anything, if you leave this conversation and you want to even identify one topic and set a goal, if you want to write out your narrative, if you want to find what you're passionate about, if you want to identify your circle of influence and then pick a platform. And one of the most important things is just give yourself a deadline and just write it. It doesn't have to be perfect. It doesn't have to be wonderful. You can edit it. But if you put pen to paper, I promise you'll be a lot more successful in creating necessary change. And then these are just resources. But any questions?
Yeah.
Jaclyn?
Go ahead.
This is Roger Hofford. Well, you did a wonderful job. I've been involved in this type of activity for the last 30 years. And a couple things also, just in addition to what you do, is that back in 1995, I had the General Assembly create a website when it's in session where folks can actually contact their legislator, but you can also comment on specific legislation that you can write out and submit it before they actually meet, where it's actually read by the whole committee as opposed to just one legislator with that. And also you can testify to that twice this year for the General Assembly before several bills with that. And then also just getting involved in committees, as you point out. Right now I'm on with the Virginia Council of Health Innovation, looking at revising the state Medicaid program. And I'm just one of several family physicians that are involved in that. But it's going to involve $8 billion of state money as you get involved in things. But one person can make a difference. And also, if you're passionate about something, actually write the legislation and submit it. I've done that several times over the years and successfully had it passed by the General Assembly and signed off by the governor. So, you can make a difference. You don't have to react, but you be proactive on recommendations. So keep up the good work.
Oh gosh, I thank you, Roger. And I think part of, we'll have to talk offline, but I think part of that too is learning from each other. I think the more I do this work, the more opportunities I learn from. And I just want to echo what you said. It's so interesting to me that, I often feel as a clinician, I'm in this kind of like circle wheel, the mouse circle, and you don't realize what is driving that redundant circle. And it's actually usually really small subcommittees that don't have healthcare professionals at the table, but they are very willing to put you at the table. And so really finding your seat there and really being intentional and focused on what you want to bring to that conversation is critical for change. So thank you so much for bringing up that point.
And also just respond to legislators. A lot of times, maybe only 6 comments may sway the day for them on how they're going to vote on a particular bill. I'll give you, for example, last year, the Safe Baby bill was in there and only 6 people commented on that. Fortunately, it did pass with that, but very few people got involved in that and pushing that forward.
It's true.
If anyone else has questions, feel free to unmute yourself and ask those. It looks like, let's see, we do have some resources put into the chat, but if you do have questions you don't want to unmute or can't unmute, feel free to also add your questions to the chat.
I can add resources, but on a local, state, and national level, most subspecialties or organizations have an advocacy arm to them, and there's a lot of training opportunities specifically for your specialty. And then just as a medical provider, where you can get more comfortable with the jargon, with the conversation, with speaking or writing, and I've taken a number of those webinars. I haven't done the actual training yet. Those are usually, you have to apply to get into them, and they're usually kind of a year-long training session, but definitely something to look into if this is something that you're passionate about.
Dean Lehrman did say, thank you for these useful suggestions and personal experiences with advocacy. He did have to leave a few minutes or a few seconds ago for another meeting. Dr. Schlubner also, thank you for being outspoken for our involvement with advocacy.
Oh, thanks.
I know that some of you probably have to go. It is 1. However, if you do have questions or you'd like to stay for a couple more seconds, please do feel free to do that and ask any questions that you might have of Dr. Nunziato. Otherwise, thanks so much. We look forward to seeing you the next time for HPHSS or any other session that we're offering.